Hey guys, Dr. Watt from Pediatric Chiropractic. Let's talk about pediatric chiropractic care. Now that's a big spectrum, right? We talk about newborns and babies that are just a few hours old all the way up through teenagers, and those two demographics are vastly different. So let's kind of go from beginning all the way through teenage years of why might somebody need to go to the chiropractor at those age groups? So what are the symptoms you could see? And then what's the benefit of those age groups getting chiropractic care? So we start with newborns. If you haven't realized this, birth is rather traumatic, right? It can put a lot of trauma on a baby, whether it's vaginal or C-section. A lot of issues can happen there. On top of that, their nervous system is just now learning how to function, right? We see babies who have symptoms like colicky, troubles latching, constipated, and those are all symptoms that are common with subluxations or these issues within the spine. And so when we adjust those, we can see that babies start to return to a normal balance within their nervous system. That difference between sympathetic and parasympathetic, or your fight or flight and your rest and digest, there's a big spectrum there. So we'll see newborns who are born and they can hold their head up from the moment they're born, right? That's not a good thing. That doesn't mean that kid's advanced. What that means is that kid is hypertonic, too tight, stuck in that sympathetic overdrive. And those kids oftentimes are the same ones that struggle with the constipation and troubles latching and things like that. And so when we adjust those patients, what are the benefits of it? You can see a lot of those symptoms return to normal. You're going to see babies progress through some of their regressions a little bit quicker, and they're going to be able to better integrate their nervous system as they age and grow. So there's a lot of value up front, even if that baby isn't seeing symptoms, but especially if they are seeing symptoms. So those are the newborns. Let's move into toddlers, because toddlers are their own kind of beast. I've got two at home and I'm fully convinced they're small terrorists, right? Well, the benefits of getting toddlers chiropractic care is they're going from being non-mobile as newborns up to these kids are jumping off everything they can find, right? So these kids are putting different types of traumas on their body. When they're learning to walk, there's lots of ups and downs and even just falls on their butts. And then as they get up to 2 and 3, they will jump off the jungle gym off the top ropes to try and see what happens, right? So those traumas, both small and some a little bit bigger, can create these same types of subluxations we saw in the newborns. Now, symptoms could be similar. We see toddlers who struggle with things like constipation. We see some of them struggle with things like wetting the bed longer than they think they should. We see some balance issues, or we see some of them skip developmental milestones like a cross crawl and carry those things into starting to try and be athletic in sports and things within that. And so as we adjust those toddlers, we'll see them progress through those things a little bit quicker as well. So we can see those kids who struggle with their balance, that can improve. We'll see those kids fall down a little bit less, and then we'll see them better be able to move through milestones like be able to throw with their right arm while they step with their left. Those are all normal human development patterns that you should see in all kids, and chiropractic is going to help their nervous system talk back and forth to their brain better and progress through those. Next, we move up into that weird age of that maybe 5 to 10 years old. They're not quite teens yet. These are the kids that are starting to get into sports and starting to move a little bit more and find their own interests. Where does chiropractic help with those kids? Well, one, we're going to help screen for things like scoliosis. And this is the time where we start to prevent their scoliosis from progressing. In fact, when we find scoliosis at those ages, we can do a lot to keep that from progressing. Once a kid hits puberty, that's at about the point where their scoliosis can't really get better. It can get worse, but it won't really improve drastically without large, huge, and big interventions. So during those years where they're growing rather quickly and they're growing a lot during that 8 to 10 year window, we can work a lot from a structural standpoint to help those joints continue to move in the right alignment versus those curves getting bigger and worse. We'll see some of the same athletic issues with those kids that we talked about with the toddlers, where they may struggle with balance. They may struggle with a few sports movements like the throwing thing that we just talked about, or when you run, your left leg and your right arm move, that crisscross or that cross crawl pattern that we talked about earlier, see it comes back. So those are all things that we can see in those age groups. We can't even see some of those things like the bedwetting still continuing to happen. Sometimes these kids, weird symptoms could be like they are extra super ticklish, right? And that's a thing within their nervous system, that their sensory nerves are extra sensitive, that just small touches flare it back up again. And we can talk about, one, how we adjust them, and then 2, exercises we can send mom and dad home with for them to work on at home to progress through that. And lastly, we get into those teenagers. These are the kids that are making a lot of big sports moves. And in today's culture, those sports are happening earlier and earlier and earlier, and the level of competition is just continuing to climb. So we can start to treat some of those kids as adults would, from a functional movement standpoint of what's the biomechanics of your throwing. We had an athlete earlier this week who was worried about a UCL or Tommy John injury because he plays so much baseball, but he's getting ready for wrestling season. How does he translate through that? And so those are the types of, one, injury support we can help with, and then injury prevention as well, helping that kid progress as much as possible, helping him perform or her performing at the highest level possible. So we can help with those types of functional movement stuff. So pediatric has this wide spectrum where we start with the newborn babies who don't do anything to these high level athletes that you treat the same that you treat like a lot of college athletes as well. So that's a big spectrum. So we do everything in our office we can to support those kids, right? Whether it is the Webster technique in pediatrics to being, I'm a CCSP certified chiropractic sports physician with a master's in sports science and rehab too. So we try and hit all ends of this spectrum to be able to help those families as their kid grows and moves and changes. There's a lot of things going on, and there's a lot for you as a parent to figure out. You don't have to have all the answers though, and that's the thing that we forget a lot of times as parents. We can develop a team around you that's going to help support your kids in every way possible. So if you've got questions about any stages of this or how chiropractic can make a difference in your household, come on in, let's chat about it.